The great thing is, and I bang on about this all of the time with the conception plan, which you may have watched and which we filmed over here with our 3 couples, is that even in situations like this, there's an awful lot that you can do yourself naturally to try and help. Not just yourself, but your partner too. So if he's got a low sperm count, there's lots of things that can be done around that. So the first pillar of the conception plan is nutrition. Nutrition is really, really vital when you're trying to improve your own health generally, but in particular if you're looking to get pregnant. So what I normally say and advise couples to do is to eat as cleanly and as healthily and as organically as possible. So this means cutting out processed food, cutting out a lot of food that's contaminated with various different sugars and salts and additives. You want to stay as clean as possible. So it doesn't necessarily mean raw, but you don't want to overcook the food and you don't want to overprocess it when you eat it.
And that's for both of you?
And that's for both of them. And I've seen phenomenal improvements in sperm counts just by virtue of the fact that people improve their diets and take more antioxidants. So you can get the antioxidants from eating fresh fruit and vegetables and also taking some supplements as well, which is a necessity nowadays because, you know, a lot of our soil is now so depleted and we just live a very different life compared to our predecessors before. Also, a lot of meat consumption contains a lot of hormones and other products that can interfere with your fertility and can interfere with sperm and egg health. So trying to stay more plant-based, which is something I also talk about a lot, is really, really important. The other thing is exercise. So I'm not sure whether either of you has any issue in terms of your weight. Exercise is important in managing that, but also in terms of managing levels of inflammation within the body. So inflammation is basically a protective mechanism that the body mounts in response to something that could be damaging. So when it's acute inflammation, for example, if you injure or harm yourself, it's a useful response. But when there's chronic inflammation going on in the body, so for example, endometriosis, or other conditions, it can start to become harmful in itself. So the way to manage that is to try and exercise and improve the amount of blood flow that's going and circulating to the pelvic organs, and trying to do at least 150 minutes a week is what's recommended of mixed aerobic and anaerobic exercise. That's for both you and your partner. So what, you know, though you say that your partner has got an issue with sperm, there could be an element of also unexplained infertility. That's about 30% of couples. And we don't know why that is, but inflammation could be a component to it, so it's really useful. Yeah, so again, polycystic ovary disease is something we talk about a lot, and 2 of our couples in the conception plan actually have this. So it's a really, really common condition. About 1 in 5 women can suffer from this in the UK. Again, it involves chronic levels of inflammation, but also what it involves is sometimes inability to ovulate within a month, and that's why usually women can't get pregnant. So using an ovulation device may help, but the trouble is with conventional ovulation devices, they may not necessarily be able to pick things up. So one of the problems with polycystic ovaries is that your level of something called luteinizing hormone, which is really key when it comes to ovulation, is something that's quite high. So some ovulation kits can't necessarily pick up the surge that comes when you ovulate and may not be that useful. So it's really important that you actually sort of take your mind off using ovulation kits and try and use the advice that I've already given in the first example, but do other things as well. So we've mentioned nutrition, we've mentioned exercise, improving the amount of sex that you have. We talk about a lot about that on the show. So trying to have sex even before you think you might ovulate is really, really useful. And in fact, we think that it might actually be more conducive towards you getting pregnant. So the fact that there's sperm around whenever it is that you ovulate is really important. And managing stress levels is a big one. I mean, you were talking to the speakers about anxiety, and anxiety is a huge factor for so many couples suffering from infertility. Again, it can be, because it raises cortisol levels, it can increase the amount of inflammation that's associated with polycystic ovaries. So trying to manage stress is really, really key. And one other point, which is another pillar of the conception plan, is trying to remove as many toxins from your environment and exposure to toxins. Again, because things that we use, which could be in our food or products that we use in our skin, could contain chemicals that are what we call endocrine disruptors. So they can interfere with hormone levels, and that's something you absolutely don't want with polycystic ovaries.
I mean, that's all
quite stressful to think about all of these things you don't even realise are stopping you from being
absolutely.
pregnant.
There's so many different complex factors to it, but I would say try not to get too fixated on when ovulation is happening, because it may happen at a time that you don't realise, but by just by trying to improve all these other things in your life and trying to reduce weight, keeping your body mass index within normal range, will in itself improve spontaneous rates of ovulation.
So that healthy way of life.
Yes.
And it's difficult for, you know, a lot of people think, oh my God, sort of cutting down on the drink or eating the right food. But that if you are after your baby, then that is the first step.
Absolutely. It's a real commitment. That's what it is. And again, you know, it's something that we explain in the conception plan. It's really, really massive, but there's loads of things you can do. So I want you to feel encouraged and good luck.
Thank you very much.